This video will show us how to assist a patient with history of asthma that has prescribed metered dose inhaler, or MDI. Let's go over the actual device. These inhalers are designed to propel a specific amount of the aerosolized medication into the lungs as the patient inhales. It's usually prescribed to people that have a history of restrictive airway disease, such as asthma, and chronic obstructive pulmonary disease, or COPD. It has three parts to it: the canister, the metering valve, and the mouthpiece or actuator. This metal canister contains the chemical propellant and the medication suspension. The medication prescribed is usually a steroid, such as Qvar, or a bronchodilator, such as albuterol. Some may contain a combination of both, such as Advair. In an emergent situation, the most beneficial inhaler is the bronchodilator inhaler. The metering valve is inside the plastic holder and allows a specific amount of the drug to be delivered. The mouthpiece atomizes the formula inside the canister so it could be inhaled into the lungs. Some MDIs have a dose counter that will let the user know how many puffs are left before it is empty. Unfortunately, most do not have this counter. The user should calculate how many days it will be good for based on the average number of puffs he or she uses per day. But in reality, we come across a good number of patients that instead shake their MDI to determine whether or not the canister is empty. While there may still be a product inside the canister, this may only be the propellant instead of the medication. The biggest problem we encounter with using the MDI, other than the fact that it might be empty, is that our patient does not inhale the medication while the actuator is being depressed. Because of this, it is recommended we use a disposable spacer. The chamber inside the spacer can hold the aerosolized medication for a few more seconds so the patient can inhale the medication after we've depressed the canister. Some spacers have a whistle integrated within it. If the patient is breathing too fast or too strong, it will create a whistle alerting us to coach our patient to take a slower and deeper breath in. Enough talking though. Now let's try to use it. As always, let's follow our local protocols and consult our medical direction. Most of the time, the prescribed canister should already be in the plastic holder. If not, place one inside. Make sure we have the right person, right drug, right date, right dose, and right route. Shake the inhaler vigorously for about 30 seconds. If the MDI has not been used in a few days, or if it is new, let's prime the MDI by spraying the contents a few times into the air. Now we will place 2 fingers on the top of the canister and our thumb below the base of the mouthpiece. Insert the mouthpiece comfortably into the patient's mouth. First, ask the patient to exhale all the air out, and then have them take a slow, deep breath in and simultaneously press the canister down to deliver our metered dose of our bronchodilator. After delivering the medication, remove the device from the patient's lips while coaching our patient to hold their breath for a few seconds. Finally, instruct them to slowly exhale through pursed lips. If we have access to a disposable spacer, let's remove the cap and attach the larger opening of the spacer onto the mouthpiece. Let's insert the tip of the spacer's mouthpiece comfortably inside our patient's mouth. Now we will depress the canister and fill the chamber with the medication. We will then ask our patient to take a slow, deep breath. After the patient has taken a slow, deep inhalation, let's remove the device from the patient's lips while coaching our patient to hold their breath for a few seconds. We then should instruct them to slowly exhale through pursed lips. Always keep in mind that MDIs are only able to deliver a maximum of 25% of the medication into the lungs if delivered appropriately.